Welcome to the TRT and Hormone Optimization YouTube channel. As a guest today, back with us is Amy Wecker. Welcome, Amy.
Thank you. It's good to be back.
Great to have you again. So today, let's talk about optimizing our thyroid. We're not talking about clinical symptoms of hyperthyroidism, but just like the channel of our name, optimizing our thyroid. So who really needs it? How do you know if you need optimization of the thyroid? So go ahead.
Well, thyroid is actually a topic that is pretty near and dear to my heart because I myself am hypothyroid. So I've really learned a lot about it over the years and I love to talk about it. And as a physician, I really try to make sure that everybody's thyroid is working well. So I think there's two things. I mean, of course, first you have to look at the labs and then you have to look at the symptoms. And I think that hyperthyroidism is a lot less common than hypothyroidism. We probably should, I mean, we can talk about hyper if you want, but we probably should mostly talk about hypothyroidism.
Yeah, sure. A lot of people like me myself are subclinical hypothyroid. I've been subclinical hypothyroid since I was 25 something. I just discovered it on a lab really. And I started taking thyroid hormone, but a lot of people don't even have symptoms of hypothyroidism, all right?
Yeah, well, it's interesting actually. So I'm a board certified internist and infectious diseases specialist, and then many years after that, I went back to school to do a fellowship in functional anti-aging and regenerative medicine. So it's interesting. I still have to take my internal medicine board recertification every 10 years. And the difference between what's considered to be normal labs in the conventional medicine world and the functional medicine world, it's just crazy. So in the conventional medical world, we look at the TSH, thyroid stimulating hormone, and of course we look at that in the functional medicine world too. But if you look at the lab panel from, let's say, Quest, which is a commercial lab, do you have that over there?
No.
I'm sure it's totally different. So we have two big commercial labs here in America, Quest and LabCorp. And so if you look at the range on the TSH, and maybe I should go back and explain what the TSH is. So let's talk about the labs. So your brain makes a variety of signaling hormones to talk to your endocrine organs. And a lot of those will be something SH, and the SH stands for stimulating hormone. So TSH is thyroid stimulating hormone, and your brain makes that to talk to your thyroid. So the brain says, hey, thyroid, you have to make some hormones. And so if the thyroid responds properly, then that feeds back to the brain and the TSH stays normal. And so if the thyroid is sick or sleepy and doesn't respond, then the brain turns up the volume. Then the brain starts to talk louder and the TSH will go up. The brain is like, thyroid, you have to make some hormones. But if the thyroid is really sick, it doesn't respond, then the brain will start to scream. And so you'll have someone, let's say, come into the hospital unconscious from severe hypothyroidism with a TSH of 75 or something. But that's usually not what's going on. But if you look at the range from Quest, let's say, they'll say that a normal TSH is between 0.45 and 4.5. But actually 4.5 really is too high. And what we learn in the functional medicine world is the TSH really should be between 1 and 2. And so there's a lot of people that are higher than 2, let's say somewhere between 2 and 6, and they're not going to get treated by their conventional doctor. And actually, when I recertified for internal medicine a few years ago, I did my 10-year recertification, and I was kind of shocked that they are saying, oh, get a few lab values and you don't really have to do anything until the TSH is up to 10. It's like 10, like that people are sick at that point, So that's one thing that you have to look at is the TSH. And the other, there's a whole panel of labs, which is why we're doctors. The other thing that you have to really look at, and you look at all of them, but the two big things I think are the TSH and then the free T3. So your free T3 also should be in probably the upper third of the normal range, which would be like over 3. And a lot of people have kind of a low T3, and I'll explain what the thyroid hormones are in a second. But some people can have kind of a low T3, but a normal TSH, and then your doctor says, well, your TSH is fine, you're fine. But a lot of people don't feel fine. You can feel tired, cold, sluggish, thin hair, thin skin, dry nails, and again, the symptoms. I mean, you're not unconscious, like you're functioning, but you're kind of dragging. And actually, one of my closest friends, she kept telling me for a long time, she's tired, and she goes to her doctor and tells her everything is fine. Finally, she came into my clinic. We did a lab panel, and her TSH was about 5. And I said, wow, okay, you have to go on thyroid hormone. And she said, well, but they just ran these at my regular doctor's office, and he told me everything was fine. And I said, of course he did, but it's not fine. And I put her just on a tiny little baby dose of thyroid hormone, and she feels great now. And again, I mean, she was functioning, it's only 5, like she's fine, she could get up, go to work, blah, blah, blah. But she was exhausted. She stopped really going out much. She just gets so tired at night. And I mean, she's only 40. She's not supposed to feel that way.
Yeah.
And everyone just tells you, oh, well, we've talked about this before. Everyone just tells you, oh, well, if you're over 40, you're just going to be tired. Things are just going to hurt. You're just not going to be at your peak. But that is total nonsense. Oh,
so
I can't.
next to the TSH, you have free T3. Here in the labs, we also have free T4. At what point do you decide we have to do something?
Yeah, well, we also have free T4, reverse T3. Like, there's a whole host of labs, but I think that the two most important are the TSH and the free T3. So I would take a look at the TSH and the free T3. So let me go back and just give an overview of how this works. So your thyroid produces a variety of things. Okay, T1, T2, T3, T4, calcitonin, but the predominant things that it produces are T3 and T4. So that's what we'll focus on. So T4 is the predominant thyroid hormone that your thyroid makes, and it's actually a fairly inactive thyroid hormone. And then T3 is the active thyroid hormone, and T4 is thyroxine, and T3 is triiodothyronine. And so T3 is the active thyroid hormone, and your body produces T4 to T3 usually in a 4-to-1 ratio. So mostly T4, but some T3, and the T3 is the active thyroid hormone, so it is critically important. Your body will then, so it makes some T3, and then also it will convert T4 to T3 as needed. So T4 has a much longer half-life. T3 doesn't last that long, but T4 lasts a lot longer. So you make some T3, mostly T4, and then your body converts the T4 to T3 as it needs. So what happens is, so when you look at the labs, so I don't know, it's kind of a combination of all things, right? So the optimal TSH is between 1 and 2. But I wouldn't necessarily give someone thyroid hormone if they had a TSH of 2.5 or something. Anything over 3, I start to think about it. And then you have to look also at the T3. So the T3, the free T3 should be over 3. So if it's, and you guys probably have a whole different system of measurement there. Yes, no? Well, anyway, so if the free T3 is under 3, then again, you also might think about a little bit of thyroid replacement. And then you have to ask, of course, the patients how they feel. And if they tell you, I feel tired, which honestly, almost everybody feels tired, for one reason or another. I mean, feeling tired is multifactorial, right? It can be from, a huge list of things, but the thyroid is definitely one of them. So I wouldn't hesitate. I mean, usually if things are a little bit hypo, my first line strategy is to try to nourish the thyroid with some supplements. We can talk about that in a minute. And so I try to nourish the thyroid, and then sometimes that's all you need, and sometimes it's not all you need. And then I'll repeat labs in a couple of months. And if the labs don't look better, then I will offer a little bit of thyroid replacement. So and this is the interesting thing about thyroid replacement. So the standard in conventional medicine is levothyroxine, which is 100% synthetic T4. And when the first part of my career, the first 7 years of my career, I worked in a multi-specialty group, and we had endocrinologists. And so I got to know the endocrinologists pretty well. And all they ever use is...
This video is sponsored by Mizumi, the #1 pick for men on TRT. Shop now at Mizumi's using the link in the description under this video.
levothyroxine. It's a brand name is Synthroid here in the States. So all they ever use is the levothyroxine, synthetic T4. And the problem with that is that will go ahead and feed back to your brain to normalize your TSH. But if you have a sick thyroid, which is the reason that you need the thyroid medicine in the first place, like if your thyroid is functioning perfectly, then you don't need anything. So you have a sick thyroid, okay, and then you give 100% synthetic T4. And the problem is people that have thyroid disease, they don't convert it that well. Not everybody, but most people, they're kind of sluggish converters. So you give the T4, but it doesn't adequately get converted into T3. So you still feel tired. And then you tell your doctor, look, I still feel tired. And then your doctor says, well, your TSH is fine. You're fine. But you're not fine. So there's an alternative to that, which is Armour thyroid, or there's another one, NP thyroid. And then this was the original thyroid medication. And this is actually thyroid. So what they do is they take pig thyroid and they dry it out and they make it into little pills. Yeah. And so when you take pig thyroid, and then for anyone who doesn't know, pigs are very genetically similar to us. So we use pig heart valves. They're actually growing these genetically modified pigs now to use for kidneys. Have you read about this?
Yeah, I read that.
The kidney transplants. I mean, this is pretty interesting stuff. So, and we used to use pig insulin. I mean, now all the insulin is synthetic, but we used to use pig insulin. And so it makes sense anyway to take the products from a pig. And so this is dried out pig thyroid, and it was the original thyroid medicine. And because you're replacing thyroid with thyroid, you get the T4, T3, T2, T1, calcitonin, like every single thing that's in the thyroid in exactly the right quantity, because you're replacing thyroid with thyroid, not with this 100% synthetic T4 that may not convert properly to T3.
Yeah.
And I have changed literally 100% of my patients, minus maybe like a couple of people that have really fought me on it. I have changed everybody from Synthroid to Armour when they come to see me over the last, I'm going to say like 8 to 10 years of my practice. And everybody just feels so much better. You know, they'll come in like a few months after I've changed them, and they'll say, oh, my brain fog has lifted. I'm thinking so much more clearly. I didn't even realize I had brain fog until I got switched to this new thyroid medicine. I have energy. I feel better. I mean, it's like pretty miraculous.
Yeah. I did that myself as well. I took levothyroid for T4 for 20 years. And then I switched to Armour thyroid as well. But here in Belgium, you cannot get it on the Belgian market. You can only get T4 different brands. So I have to order it, outside of Belgium. So
it's so crazy, right? And how did you feel after you made the switch?
Yeah, it made me feel much better. Yeah, more energy, especially.
Yeah, because you get the T3 that you need, and I cannot figure out like why the endocrinologists are so resistant, and it's got to be some kind of a marketing thing.
Yeah, they're not even considering bringing it on the Belgian market here. No, we're fine. We have T4. So crazy.
Yeah, no, it's crazy. Like, and I mean, I've been doing my own experiment for 10 years. And I mean, when I was diagnosed hypothyroid, it was by a functional medicine doctor. So she just started me on Armour. So I've never taken anything else, but I've changed everybody, and it's just crazy, like how much better they feel. So okay, so that's the story with the thyroid medicine. And to go back though to the supplements, so you have to nourish your thyroid. So the two biggest nutrients that your thyroid needs are selenium and iodine. But your thyroid also needs, like, you know, a solid multivitamin, because your thyroid needs B vitamins and vitamin D and all this other stuff. But the two big things are selenium and iodine. So not to promote a specific brand, but I mean, I do love the Pure Encapsulations supplements, and they make a thyroid support formula. And that has exactly the amount of selenium and iodine and everything else that you need in it, the B vitamins, to really nourish your thyroid. So good sources of selenium, as I think we all know, or maybe we don't. The best source of selenium probably is Brazil nuts. So if you eat 2 or 3 Brazil nuts a day, that gives you all the selenium you need.
But no one does that anyway.
No one does. I actually do keep Brazil nuts in my kitchen, and I try to eat a couple a day. But yeah, right. That's, And then in terms of the iodine, you can get iodine from sea vegetables, which again, no one really eats. I mean, if you go for a sushi, maybe you get a seaweed salad. That's probably it. And then also from shellfish.
Mm-hmm.
And those are
it's not enough living at the coast like we do here.
I know you have to actually eat the shellfish.
But we do eat a lot of fish and seafood anyway. Yeah.
Perfect. Yeah. So the one caveat with iodine, I really like to use a supplement that has a little bit of iodine in it rather than actually supplement with iodine, because the few times that I've given somebody straight iodine, they've ended up grossly overdosed. And so even when I try to just give a little bit, the levels end up too high. So I never give anybody iodine anymore. So I just use, I like a thyroid blend that just has a little bit of iodine that's hard to overdose yourself. Because sometimes, people think more is more, even though you say less is more. And then you check the iodine level and it's 300 and you have to.
Are there any differences between men and women in optimizing thyroid?
Well, a lot of women can start to have a sluggish thyroid when they become perimenopausal. And so it's really important to nourish the thyroid around that time and to also really pay attention. But I'm not sure what the numbers are, actually. I'm not sure what the statistics are, but men and women can both be hypothyroid, hyperthyroid. There's definitely a strong genetic component. You have relatives who are hypothyroid?
Excuse me?
Do you have relatives who are hypothyroid?
Yes, my grandmother had the hypothyroid as well. Yeah.
So. Yeah, me too. My dad and my aunt on the other side. So it's not like there's definitely a genetic component to it, although it's not some kind of absolute genetic inheritance.
Okay. Are there any other investigations to do next to blood work?
Well, I think really just blood work and then paying attention to the clinical symptoms. And you can see a lot of stuff on physical exam as well. So if you've been untreated hypothyroid for a while, you are going to have thinning hair, thinning nails. You can get a really thin outer third of the eyebrows. So this part here can be really thin, but you can also get that just from aging. So again, and you can get some ridges in your nails. But I feel like now that we have all these lab tests so readily available, the art of physical exam has been lost to a certain extent. I mean, I remember when I was in medical school a long time ago, and you have these professors that will just show you all these crazy things on physical exam as you make rounds in the hospital on the patients. And honestly, as since we've always had all these lab tests to order and imaging and everything the whole time that I've been a doctor, I'm not sure that my physical exam skills are at that level at all. I mean, I can pick up a few things, but not like, these guys, you look at you and touch you and they can tell you so much stuff. And a lot of that stuff I think has been lost. Yeah,
I know the feeling. Yeah. There's no need to do any ultrasound of the thyroid.
If you feel a mass in the thyroid, of course you want to do an ultrasound. And if you have hyperthyroid, then that's really when you want to do an ultrasound, because you want to see if there are nodules. Because if there are nodules, you would consider investigating it for thyroid cancer. But if you have hypothyroid, unless you feel a nodule, you don't necessarily need to do any imaging. The other thing you should do with hypothyroidism, not necessarily super mild, but if it's a kind of a more significant hypothyroidism, you do want to check for autoantibodies. So you have a lot of reasons to be hypothyroid, but one of the more common ones is outside of just not having your thyroid properly nourished, one of the causes of real thyroid disease is Hashimoto's, which is autoimmune thyroid disease. And so in any autoimmune disease, your body decides that part of it is foreign and starts attacking it. And so that's what happens in Hashimoto's. I actually have Hashimoto's. And so then you measure the thyroid antibodies, the antithyroid globulin, the thyroid peroxidase. And if you have, well, I mean, if you have any type of autoimmune disease at all, you have to really live an anti-inflammatory life. So I think the number one thing to do in that case is to get off the gluten. I think the gluten is different in Europe. I don't know. I mean, in America, the gluten is poison. And so gluten, it's not good for anybody. I mean, I recommend that everybody go gluten-free, but if you have any autoimmune disease, it's really, really important to go gluten-free, and also probably to stay away from A1 dairy and to stick to A2 dairy. And you know all about that, the different kinds of, the two kinds of casein.
Yeah. But I know in the United States, it's really a thing, everything gluten-free and so on. But here, there's not so much attention to it for the moment.
Well, so it's interesting. So I'm not an expert on plant genetics, but plant genetics are really different than human genetics. So with people or animals, you get 2 sets of chromosomes, and that's it. The cell multiplies. There's a very brief period of time where you have 4 sets of chromosomes, and then it divides, and you have your 2 sets, and that's it. But plant genetics are different, and I know that wheat can accumulate sets of chromosomes, and so a wheat could have like 64 or 128 sets of chromosomes. And so the wheat in this country is all high gluten, genetically modified. And even if it says that it's non-GMO, it's all grown in the same areas of the country, and the spores go through the air. So even if it's not purposely GMO, like, it's still GMO. So it's different in Europe. The gluten in this country, the wheat is a high gluten wheat, all of it. So I think that's why it's more important to stay away from it. Because I know when I go to Europe, I eat whatever I want and I'm fine. But in this country, I am very, very strict about being gluten-free.
Okay, right. Going back to the thyroid, how to dose the medication, when to take it? Right.
So we'll just talk about Armour, because that's what I use. And again, this is pretty interchangeable with NP thyroid. Those are the 2 common brands of natural thyroid. So I always start, well, it depends. So if somebody has never been on thyroid medicine and they're just a little bit hypothyroid, I always start with the lowest dose. So the way that I was trained in my functional medicine fellowship, and according to everything, start low, go slow. You can always add more, but if you give too much, you can run into problems. So I always start with the lowest dose, which is 30 milligrams or half a grain, however you want to talk about it. So I'll start with 30 milligrams and then wait 2 or 3 months, recheck the labs, and then go up from there as needed. And now if you're converting somebody, it's a little bit different. So if it's hard to sometimes calculate an exact conversion, so I'll usually just go to like the next lowest dose. So if someone was on, let's say, 150 micrograms of Synthroid, I would maybe go to 120 of Armour. And you have to basically just take a guess at that point. Like I said, I usually just go to the next lowest dose, because you do have the full component of everything in the thyroid, so you need a little bit less. And so I'll just go drop it down 1 notch, and then again, wait a couple months, check, see. And even if you're on thyroid medicine, you still have to be on a thyroid vitamin or something, because you still need to nourish the thyroid.
Sure. Okay. You have to take it in the morning every day before breakfast?
You take it in the morning every day. Yeah. So that's actually a nice thing about the Armour or the NP, is that you only have to wait 15, 20 minutes before you could eat something else. With Synthroid, it's close to 2 hours, which is a really long time. So I just stick my thyroid medicine in my mouth the second I wake up. That's the first thing I do, is take my thyroid medicine. And then by the time I've brushed my teeth and taken a shower and gotten dressed and all that stuff, it's way past 15 to 20 minutes. And then I'm ready to have my coffee. I usually won't eat because I do so much intermittent fasting, but then I'm ready to take my other supplements, have my coffee.
Awesome. I think we covered everything, right? Anything you wanted to add to the thyroid optimization?
No, I think that's about it. I just want to encourage everybody, if you feel tired and you think you're having symptoms of hypothyroidism, make sure you have everything checked, and actually get a copy of your labs to look at them. Don't just listen to your doctor tell you that you're fine, because if you don't feel fine, then you're not fine. Okay. Nobody knows your body better than you do. If you think there's a problem, then there is a problem. I mean, if you're tired, it may or may not be your thyroid, but for sure there's something going on, and you deserve a full investigation. Get a copy of your own labs ask questions, be informed. And if you're really not satisfied, you might want to look for a functional medicine doctor.
Right. Exactly. Thank you so much, Amy. Very interesting.
Thank you.